Hey friends, it's been a while since we've talked, so we've got a lot to catch up on. Let's chat. My physical health has been terrible the past couple of weeks. I actually passed out at a doctor's appointment last week, but surprisingly, it was probably one of the best doctor appointments I've ever had. But before we get into all that, let me introduce myself. My name is Heather. I am a 47-year-old autistic and ADHD human. I am also a certified trauma-informed yoga teacher, and I am also, as of last week, diagnosed with hypermobile Ehlers-Danlos. So I went to the doctor last week expecting absolutely nothing. This was a new appointment with a new GP. My GP had retired, surprisingly. He was like 100 years old, and this was just to meet and greet the new physician. It was an hour-long appointment, and let me tell you, first and foremost, how wowed I was by this guy. First of all, young doctor from a very metropolitan area that just relocated here, and I think that made all the difference. We discussed all the symptoms that I've been experiencing for the past few years, and I'll give you a list of those in a moment. My medical history, my family history, all of these things, and by the end of the appointment, he said, "Do you have stretchy skin?" And I said, "Yeah, absolutely." He said, "Are you bendy? Are you hypermobile?" I'm like, "Absolutely." So I jumped up and started doing the bite and test score all on my own, which I'll, again, show you that in just a moment and post some links for you in the comments. But that is the clinical test for hypermobility. Not necessarily hypermobile EDS, but hypermobility in general. Passed with flying colors, and he did some other assessments along the lines of assessing that disease, disorder, syndrome, and finished the appointment with multiple referrals, tons of blood work, which is what caused me to pass out. Found out that I am anemic. On top of everything else, my body is just not processing the things that I am digesting, and I'm also having a mast cell activation. My histamine levels are off the charts. My eosinophils are super high. I am just allergic to just about everything right now. So I have been referred to a geneticist, which will be a lengthy process in itself. That will not confirm nor deny hypermobile Ehlers-Danlos, because that is the only of the 14 subtypes of Ehlers-Danlos syndrome, the only one that is not verifiable by genetics. It is the only one that there is not a specific genetic code or malformation for. But this would be to rule out any other genetic disorders or any other connective tissue disorders or anything else in the Ehlers-Danlos family. He started me on a treatment preparation for MCAS, so I am doing a low histamine diet, which is awful. I am doing an H1N1 blocker, which is H1s are Zyrtec, Allegra, Benadryl, things of that nature. That's a histamine 1 blocker. Histamine 2 blockers are, think stomach, that is like Pepcid, the thing, Zantac, things like that. So I'm doing one each of those a day to start, and the low histamine diet. And I will say the first few days, it was awful. I felt awful. I am over a week in now, and I can tell a difference. Immediately, almost, the eczema on my arms started to clear up. My airways cleared up. He also gave me some Flonase, which I had never tried before, but I have always had chronic sinusitis, which he did diagnose me with pansinusitis, which is all of the sinuses are always inflamed. He said my airways were very narrow and my palate is very narrow, which is another symptom of hypermobile EDS, and that I just probably wasn't getting enough air because they were so inflamed. And I will tell you, after one use of Flonase, I was like, oh my God, is this how people breathe? Is this what breath normally feels like? Because I thought I was breathing deep. I thought I was getting plenty of air. I'm a normal deep breather. You know, I'm a yoga teacher, so I practice deep breathing techniques. I just wasn't getting enough air through my inflamed, swollen airways. So while I was waiting for the doctor that day, I I have a notebook full of all of my testing, my diagnosis. I brought all that with me just to give for information because not everything is on their system. Some things are from different doctors and they can't see the results of those. So I always bring that with me when I'm meeting with a new doctor so that I can share that information pretty much whether they want it or not. But I decided to make a list of the most troubling symptoms that I have been experiencing for over 4 years now. And that is, these are daily consistent symptoms: headaches, eye and vision problems, fatigue, brain fog, muscle weakness and soreness, lead-filled body. I always feel like my legs are just filled with lead. They're so heavy. Shortness of breath, digestive issues, swelling, bloating, discomfort, pain, regardless of diet, incredible weight gain. I've gained about 35 pounds in the past year. Joint pain and stiffness, dizziness, lightheadedness upon standing, sometimes while sitting too. Skin issues, increased symptoms after exertion. So anytime I try to do like a workout or anything of the level that I used to do, I am wiped out for days. Tingling, thrumming pain in hands and feet. It wakes me up at night. And hip pain and extremities pain. So I've seen specialists in the past for all of these. I've seen a cardiologist, neurologist, gastroenterologist, endocrinologist. I'm currently seeing a physiotherapist and an ear, nose, and throat doctor, otolaryngologist. I do take medications each day. I take Cymbalta. I am on an estrogen and progesterone hormone replacement cream. I take DHEA to help with testosterone production because I am perimenopausal, and just some regular vitamins. And then, of course, I made a list of all the things that I've been diagnosed with so far, and this was honestly kind of not a full list, but asthma, ADHD, autism, arthritis, degenerative disc disease, hiatal hernia, orthostatic issues, and, of course, perimenopause. So based on all of the symptoms, all of the history that I'd experienced, the blood work that came back awful because my red blood cell count was so incredibly low. My MCV and MCH was very high, which both speak to megaplastic anemia. So all of that was terrible. It has been terrible consistently for years now, but it has never been addressed because, again, the system, the MyChart system that the hospital is linked with, tracks all of my blood work, whether that was taken in the emergency room, through the doctor's office, whatever the case. So I could actually go back and look at a chart, a graph of my terrible blood work, and see how those elevated numbers have consistently been bad, elevated or low, have consistently been out of range for some time now. But again, it was never addressed. And he did say that is probably part of the reason for the dysautonomia, the dizziness, the syncope, things like that, which is passing out. Syncope is passing out. That I have been experiencing, the orthostatic intolerance, which means that when I stand up, that's when I get the dizziest because the blood doesn't necessarily go to my head like it's supposed to. But dysautonomia and to some extent anemia are actually clinical signs of hypermobile Ehlers-Danlos. So let's get to the testing for hypermobile Ehlers-Danlos. There is, of course, the Beighton test score, which I will try to put a link in the description for that so that you can do a home check. But it's basically checking, and there are various doctors that think that this might not be the best test because it really only checks joint extremity hypermobility. So this is a typical flat hand. This is my flat hand. My fingers naturally go up. Are you able to bend your back pinky more than 90 degrees backwards? Being able to touch your thumb to your wrist. Mine doesn't go all the way down anymore, but it used to. As you age, you do lose flexibility, even with a connective tissue disorder. So the scoring is a little different. I believe it's 4 or more on that Beighton test score if you're over 50, 6 if you're younger, like a young adult, and between 4 and 5 if you are in between those ages. So again, the scoring is, or does your elbow extend more than 10 degrees, things of that nature. So again, I'll post that down in the comments so that you can do a self-check if you'd like. But there are some other things along with that test that they do look for. Do you have other systemic involvement? Such as prolapses, hernias, things of that nature. And yes, I do. I have a hiatal hernia for sure. Have you had skin issues throughout your life? I have. Various different things. Again, I'll post that down there so you can take a look at it. It's not all coming to mind right now because, again, my thinking has not been so great lately, and it's been difficult for me to make videos, for me to work, for me to really do anything that takes any kind of cognitive effort because my brain's just not getting enough blood, and I'm not getting enough oxygen because my airways were so swollen. So really, I was just in a miserable state, and I'm happy to say that after about a week, I am feeling a little better. I'm still going to have bad days. That's not probably going to change. I'm still going to have joint pain, things of that nature, but reducing my histamine load, which of course histamines create swelling. So that's not helping with the joint pain. So reducing that histamine load through the dietary interventions and the H1, H2 blockers that I'm taking is definitely helping. I'm seeing a difference in that. And I'll be doing that protocol for at least 30 days to see if I can see a difference. I will say that a low histamine diet is not a sustainable diet. It does cut out a lot of things that are actually very good for you, like avocados. You would not think avocados are bad for you, but in the sense of histamine, they are high histamine. Bananas, high histamine. So there's a lot of things that are on that low histamine diet that you don't want to exclude forever. But when you are trying to reduce sensitivities and kind of, they call it empty your tub of histamine, that's something that they kind of look at first. So, and histamine, that's exactly how it works. Basically, consider your body a bathtub. It gets a normal dose of histamine as reaction to food stressors, environmental stressors, things of that nature. And normally your body clears it out through the process of excretion, either through sweat, poop, pee, whatever. But when you have a histamine intolerance, your body is producing so much histamine that it can't clear out that load, and everything is aggravating it. And so you kind of have to pull the drain on the tub and get some of that stuff out so that it is not so overreactive. Now, I have considered that I had hypermobile Ehlers-Danlos for quite some time now. Honestly, before I even got my autism diagnosis, I knew that it was a major comorbidity along with neurodivergence in general, autism or ADHD. And I had done a lot of research on it, and really did kind of fit, for me, the parameters. But because I had given up on the medical system, I really was not interested in trying to pursue a diagnosis for anything else because I had been treated so poorly by all of these specialists, dismissed over and over again for all of my symptoms because it didn't fit into their narrow box of what they handled. Because it is a multi-systemic syndrome, because collagen, connective tissue, is in everything. You think collagen, you think skin, because that's what they are selling you collagen supplements for. Have young, healthy skin. But it's everywhere. Your connective tissue is everywhere. It's in every system, in every organ. And if there is a faulty production of collagen, which is basically what hypermobile Ehlers-Danlos is, you're going to have multi-systemic effects from that faulty collagen. Since the appointment, though, and the validation that I did actually know what was going on with my body, that I wasn't wrong, that my research actually did point in the right direction, I feel so relieved. And you would probably think, well, why would you be relieved to have a genetic lifelong condition? Well, because I'm relieved to know what it is that's causing my problems. And I'm relieved to know that now I can set a plan for treatment. I know how to take care of my body now. Yes, there's no cure for this, but now I know the best way to manage my symptoms, to work with other doctors, to let them know that I do have this condition, because it does affect the way that you receive treatment for lots of different things. Anesthesia has to be different for those with EDS. Lots of things are affected because, again, your connective tissues are everywhere. And just having someone listen, validate, acknowledge that, yes, there is something wrong with you, and it seems like there's been something wrong with you for quite some time, and let's take some steps to make you feel better, I think has been the most life-changing thing. So even though I passed out at the end of the appointment because I was doing so poorly, I felt so renewed afterwards to be able to finally start doing something about all of these health issues. So for the first 30 days, because I don't want to do too much at once, what I am working on, what I main focus on is reducing that histamine load with, again, that low histamine diet, the H1N1 blockers, which you can do forever, but that will help reduce that tub, drain the tub a little bit, and reduce the reactivity. So that's my focus now, and to get more movement every day. I've had to back off of yoga for a while simply because I am hypermobile and I know I'm overextending my joints. And I want to build up a little more muscle before I go back into practicing on a regular basis, because losing muscle tone is one of the reasons that I have gotten to such a bad state with my EDS. When I was working out and I was in great shape and I had fantastic muscle tone, I had very little pain and soreness because my muscles were doing the work that I'm now forcing my joints to do. I lost my conditioning because of the syncope and the POTS-like symptoms and the dysautonomia, the getting dizzy every time I stood up, the getting exhausted every time I exerted myself. It's very hard to make yourself work out when you're terrified that if you just go for a walk around the block, you're going to pass out. But I've increased my hydration levels. Everything I drink with electrolyte inserts. I get about 60 plus ounces of fluid with electrolytes daily. I am considering IV electrolytes, but that's something we'll talk about in another video because that's a whole process. But for now, increasing the fluid intake, limiting my caffeine intake, which is a problem because I love me some coffee. But that is a diuretic, and it's not necessarily the caffeine that is bad for you, it's the loss of fluid. In my case, that is bad for me. So I'm limiting my caffeine intake and making some very small, simple daily changes to try to reduce that histamine load, feel better, move better, and be in less pain. So again, it has not been easy peasy, feeling great since I walked out of the doctor's office. I have been feeling kind of crappy, still experiencing the brain fog, still experiencing some of the issues that I walked in there with, but I can tell that these small changes over the course of a week, good things take time, are making a difference. So I am going to stick to it, and I will let you know how these things go, because I know many of my neurodivergent friends out there also experience a lot of similar issues. The triad of POTS, EDS, and MCAS, which is mast cell activation syndrome. POTS is postural orthostatic tachycardia syndrome, which means orthostatic. When you stand up, your heart rate increases, and that's because your body's giving it a boost of adrenaline to try to get your blood back up to your head. So that is the reason for syncope. In a lot of cases, passing out. In a lot of cases, MCAS, again, mast cell activation syndrome, and HEDS, which is hypermobile Ehlers-Danlos syndrome. That trifecta, or dark triad, as I've heard some doctors refer to it, is very common in the neurodivergent population, so much so that I've even seen some doctors relate it as a physical manifestation of neurodivergence. So we'll get more into these connections and the layover of the symptomology of autism and EDS in some other videos, but I just wanted to give you a brief rundown of all the things that I've been experiencing lately and share some of that with you. I hope that this has been helpful for you if you are experiencing any of these symptoms. Let me know in the comments if you have tried a low histamine diet, if you have tried the H1N1 blocker, or H1, H2 blockers, and if that's helped you any with mast cell activation or histamine intolerance issues. I'd love to hear more, and more of what you would like to hear about these syndromes that I have now been diagnosed with, so that we can get into it. So thank you for listening. As always, I appreciate you, and I hope you have a wonderful day, and we'll see you in the next one.